Hello, Miss Rose. My name is Raquel, and I'm a nurse working with Dr. Boateng. Dr. Boateng did your surgery a few days ago. So, can you tell me your name and date of birth?
Well, hi, Raquel. My name is Sharon Rose. I was born October 20th, 1948.
Great. Thank you. This is a follow up visit. Um, we will have a short conversation and I will find out if you have any problems or any issues that we need to bring up to Dr. Boating's attention. Do you have any questions right now?
Well, thank you so much for making contact with me. I do have a few questions since I last saw him.
Okay, let us review your health information before I answer your questions. When did you have your surgery and what was the surgery for again?
I think it was almost 2 weeks ago, so it should have been like November 20th, and it was for my gallbladder. He had to remove my gallbladder.
Okay, so I see in your chart that you actually called 911 to go to the emergency room.
Yes, I was in so much pain. I had just finished eating and it was really just really bad pain. But I was so afraid. I didn't want to go to the hospital because of the COVID, and I was not even able to stand. And then I just decided I had to call 911. So they did take me to the hospital, and I had to have surgery.
Yeah, you did the right thing in going to the emergency room because there are possible complications. We needed you to be treated right away. So it was just that day that you felt that much pain.
Yes, every once in a while I do have, stomach pains, especially after I have eaten. And that day I may have eaten something that was not good for me. I had some fried chicken. I wanted something and it was fried and fatty, and probably I should have avoided it, but the pain was so bad and I had to go ahead and call 911.
Yeah, so what was your diagnosis then? Do you remember?
Yes, he told me I had gallstones and that they were so bad that they were almost blocking or obstructing something.
Hmm.
So it was good that I did call 911.
Mm. Yeah. So, how are you doing otherwise? How was your last visit to the surgeon's clinic?
Yes, he saw me November 25th, I think I saw him, and I had dressing. He had removed the dressing and he removed some of the staples in the little three incisions, and he told me I could start showering, so I did start doing that. There was some drainage and some redness, but I'm continuing to shower and let the warm water run over it.
Are you still experiencing any drainage? And how do you describe them? What's the color of the drainage? What's the odor? And what about the other incisions?
Okay, it kind of stopped a couple of days ago, but the drainage was yellowish. It was yellowish drainage, and the area was a little red and puffy, but I think it looks better now.
Okay. Well, you can continue taking a shower over those incisions, I should say. I see that you have also been prescribed antibiotics. How is that going?
Okay, I have 2 more days of the antibiotic, and I have 4 tablets left, so I'm almost finished with the antibiotics.
Mm-hmm. Yeah, I see. So those antibiotics that would have to be completed. So tell me about your diet.
He told me to eat food as I tolerated and to stay away from fried and fatty foods. So no more fried chicken have I had, but I have been doing just small meals. I will have maybe an egg or something at breakfast with toast, and then lunch will be soup and a sandwich, and then at dinner I may have a salad and again a small meal, baked potatoes or something like that. But I've been trying to cut down and not to have too much of the fried and fatty foods.
Yeah, so with all of this COVID restrictions, so are you cooking more at home?
I cook a little. I have to be honest. I do tend to have delivery sometimes, but since I've been home, I have been doing well with just preparing foods myself, and I think I'm doing well. He told me to just eat to my tolerance, and I'm feeling better with it. I have not had any pain.
Mm-hmm. Yeah, so I hear you. You have to be careful with your diet. Nutrition is very important for your recovery from the surgery and for your overall health. You really need to avoid fried and fatty foods.
Okay.
And what about your bowel movements?
Well, that's what the question was because I didn't know whether the antibiotic would change my bowel movements, but it seems like I'm having more since I've been on the antibiotics. I usually would go like once a day, but now I'm going like three times a day. And so I was just wondering if the antibiotic, caused it.
Sometimes antibiotics, you can have side effects from it, and yeah, diarrhea is one of them. But the antibiotics do need to be completed. So you say you have bowel movements 3 times a day. Can you describe to me the stools again?
Well, they are not watery, but they are very loose. So yeah, it seems like it just as soon as I eat, it just comes through type thing. But they are not watery. They are not watery. They're just very loose.
Okay, so we will inform Dr. Boating about that. Are you taking other medications as well?
Yes, my medical doctor has prescribed blood pressure medication, which I take every morning, and then I have an asthma medication that I take every evening, and then, of course, vitamins.
You do need to continue taking those medications. And well, I see here in your chart that you live alone. So, how are you doing with all of these COVID restrictions?
Oh, my daughter works for the State Department, so she's out of the country. And of course, with all the COVID restrictions for travel, she will not be back in the USA for a little while. But I do have, activities and interactions with regular people that I do miss. It's somewhat challenging. I miss my church activities and services, but I do try to talk to people, and my daughter makes contact with me maybe 2 to 3 times a week via Zoom. We do have communication on Zoom.
So, how are you feeling otherwise? Are you lonely or depressed?
Well, I do miss activities. I do. I used to go out to lunch maybe once or twice a week with friends. But since we are restricted with COVID, at least we talk and we do Zoom. So I am not feeling depressed. I do wake up sometimes in the middle of the night and turn the TV on, but I don't feel like I'm depressed. I just miss the activities and the interactions.
We can also connect you to a therapist. So, do you think you need to see a therapist right now?
No, I think I'm managing now. I feel like as long as I have some outside contact with the phone and Zoom, I'm okay. But it's good to know that the services are available should I need them. But right now, I feel that I'm okay. Thank you so much.
Well, I'm glad to hear that you're doing great. Otherwise, before I call the doctor, do you have any other additional questions for me?
I think that you did clarify about the antibiotics and the diarrhea and the drainage has stopped. So I feel that it's been helpful. So I appreciate it.
All right. It's been nice talking to you, Miss Rose. I am going to give my report to Dr. Boteng. So do not get off this meeting yet. I'll go get the doctor. So I wish you well.
Thank you, and I know the doctor's not going to discharge me just yet. So hopefully I will talk to you again. But I appreciate the contact today and your checking on me. Thank you so much. I'll wait for the doctor.
Yeah, thank you, Miss Rose. Bye.
Bye bye.